This is Steve Zeltzer with WorkWeek in San Francisco. The attack on workers in the United States during the COVID crisis continues. Included is increasing discrimination against African American and also retaliation for making health and safety complaints around the issue of unsafe work practices when dealing with the COVID potential contamination. And I'm talking with two healthcare workers here in San Francisco who work for the Department of Public Health. Brenda Barros, who works at San Francisco General. She is also chapter chair of SEIU 1021 at General Hospital, and also Cheryl Thornton, who's at a community health care center and with the Department of Public Health, and also a steward and vice chair of the community healthcare chapter at San Francisco Department of Public Health. Welcome, both of you, to WorkWeek.
Oh, thank you, Steve.
Thank you.
So, Brenda, why don't you talk about the crisis at San Francisco General, the COVID, and what is happening with workers, frontline workers such as yourself, and also Cheryl, who are facing not only a crisis of protecting your health and safety, but also the different conditions that is taking place for these workers, for yourself and others.
Yeah, so there is, since COVID, most of the workers have been more than willing, jump in and step in about what's going on. But I think part of the problem is the general feeling among the workers, a lot of the workers, is that some things are COVID and some things are not. And they feel like management might be using things that have nothing to do with COVID to make changes based on COVID, and therefore abusing the system.
And there has been a long history at San Francisco General. Both of you have been leaders in the fight against racism, systemic discrimination, attacks on whistleblowers. Cheryl, is that still going on in the midst of this crisis?
Oh, yeah, for sure. It's like Brenda said, COVID is, yes, we're in the middle of a pandemic, but what I see is workers' rights are being violated from the city ordinance to state level, Cal-OSHA, all the way up to the feds, as far as having the right to leave work with underlying conditions. So I see across the board that we're being violated. We're not being provided protection, PPE, proper clothing in this crisis. And I also see a disparity how some people of color are forced to the front line without any exposure plan, without any mechanisms to protect them. And unfortunately, many times we are exposed to, COVID, for example, and then we don't have the protection and we take it home and it maybe possibly infect our families. So, yeah.
And I understand.
And that is a major issue for a lot of employees. It's we don't mind coming here. We don't mind putting our lives on the line. But in many ways, sometimes people feel like their families are also put on the firing line, and they shouldn't be. If I got tested, I had no choice but to go home to where I have somebody who's 7 years old with health issues, because there's nowhere else to go if you're tested and you're supposed to be, away from people, but you can't be away from people because they tell you to go home and you have other people at home. I know the sheriffs, I heard that they got some rooms at the Intercontinental Hotel. Why the city can't do that for all city workers, I don't know.
And we have thousands
have to go home. If they say, we know you have been in contact, we believe you, we're going to test you, and it's related to the work you do, those people should not have to go home and wait that out with their family. They should be somewhere else just in case. In mine, thank God it was negative, but what if it was positive?
Then you would have infected your family.
And I was exposing people in my house.
Yes. And there are thousands of empty hotel rooms in San Francisco. Why haven't frontline workers such as yourselves been allowed to go to hotels if you're fearful that you have COVID-19?
Well, I'm upset a little bit because I just found out the sheriff had 10 rooms at the Intercontinental Hotel that they could use. So it seems like foreign people are getting those opportunities where people who are not foreign are not. And so we have this debate over what is frontline.
So see, what I want to say is this, is that I feel like the city did not do good emergency planning for a pandemic because none of these things are really thought out. And we knew a pandemic was coming in 2010.
On a radio.
So I think like Brenda, I agree with Brenda.
Right.
We should be giving hotel rooms, to our unions, whatever federal protection, FEMA, so that we don't have to go home and infect our families and spread it. But see, Brenda brought up a point earlier about the abuse that's going on in DPH. In the city as far as DSW workers. Lots of us are being deployed to different assignments or being reassigned, but we're not even receiving DSW letters and being activated. So what I think Brenda was alluding to is how management is using management's rights, so to speak, to do a reorganization and say, oh, the contract is not in play right now because we're in an emergency. But the fact is, if we don't, as DSW workers, don't receive a letter, then we're not activated. And anything that happens to us should be covered under our contract. But management is trying to use this as an opportunity to do what they want. That's what we're seeing.
And you have some experience as well with Cal-OSHA. You felt you were retaliated for making some complaints about the health and safety conditions you were concerned about. Why don't you talk about that, Cheryl?
So, yes, my work assignment was Southeast Health Center, Tom Waddell and Curry Senior Center. And Southeast Health Center is the epicenter out there in Bayview it's a testing site, and it's also a urgent care now as a response to the people in Bayview Hunters Point that may be coming in with COVID. So there's a field clinic out there. But anyway, the director, my supervisor, they decided that they were going to implement a screening table in front of the clinic, and they put us out there without an exposure plan or anything. So what happened is a patient inevitably coughed on me who didn't have protection. And so I complained. I filed a workman's comp claim. And then furthermore, they sent another plan saying that they wanted us to go bedside to interview people who were high suspects of COVID without PPE, without proper clothing or PPE. So I called Cal-OSHA and filed a complaint about it. And I have been retaliated. I believe I was removed from my site of Southeast Health Center. I was removed and redeployed only to Tom Waddell and Curry. So as of Sunday this week, and so it was 2 days after I made my complaint that I was reassigned.
And who reassigned you?
My supervisor. And secondly, I did ask them, I filed the workman's comp, but he's yet to process my claim. He's saying that due to the pandemic that he doesn't, things are going to take longer than normal and there's delays, and he'll let me know. Because I don't really care that I have someone I'm living with underlying health conditions. The city never tried to set me up with occupational health to get a test to find out after they were so negligent to send me out to a screening table with no protection. So, yeah, it's frustrating. And
you called Cal-OSHA. Now, Cal-OSHA only has less than 200 inspectors for 18 million workers. Has Cal-OSHA been out at San Francisco General to investigate these complaints and to make sure that the frontline workers such as yourselves are being properly protected?
Well, when I haven't seen them at Southeast Health Center. Brenda, have you seen Cal-OSHA? Yeah, so, they have not.
Yeah, so I would say on that, we filed a grievance. I filed a grievance. And Human Resources being totally unresponsive, acting like because we have COVID that they can't look into things like Cheryl being removed unreasonably. And, it's totally unreasonable what they have done this year. And it is clearly retaliation in the eyes of anybody who can see. And yet they still choose to just let it happen. And one of the things that Cheryl's been pointing out that we're dealing with is, why are all the black employees who work at Southeast Health Center, where the most black patients are being removed from that clinic? Nobody has been able to answer that question.
The issue of African-American black employees, black workers, their families being more likely to die because of COVID, do you think that this is an example of the systemic racism in our society and discrimination against blacks in the United States?
Absolutely it is. And, I brought it up here in my job, in the lobby. I've seen some incidents where I had to, interject myself to protect the black patients, because these same problems that were here before COVID with the discrimination in healthcare, to me, it can only have magnetized, and we have to be extra vigilant to make sure that it doesn't get crazy. They've been saying, there was a woman on Facebook on New York. She was saying that, don't believe what they're saying in New York. What happened, you get told the story of what happened to her sister, a black woman, when she walked, middle-class black woman, who walked into a hospital in New York, and how she was seen multiple times by multiple providers, each one saying she didn't have it, until she got so sick. And she came in, and then finally they did the test. But all those other times when that woman came in, they did not test her, and she had it. So those are the things we have to look at.
Right, and so, Steve, Brenda brought up a very good point that I didn't point out. At Southeast Health Center, they only instructed black staff to go out to the screening table and screen for cough and fever, possible COVID, screen for possible fever and cough, but yet none of us had protective gear. And so when we complained about it, yes, that's when the retaliation, I believe, started. Right, there is a disparity. They're seeing black workers, I think, as blue-collar workers. We're not offered telecommuting options or other options in case we have underlying health conditions to protect our health, safety, and health. So I think, there's a huge disparity that's going on, and I think it's going on across the nation.
And what should the union be doing? SEIU has 750,000 members in California. They've supported Governor Newsom. They are supporting the Democrats. What should the union be doing? Because the union is a powerful force if it wants to be. What should the union be doing in the face of this pandemic and flagrant retaliation and discrimination at San Francisco General?
They should be standing up for the workers. Plain and simple, that's it. They need to stand up for the workers. They need to fight for fairness, fight for eliminating discrimination in this environment. And, I have to say at San Francisco General, our management is receptive to that. But I keep saying this over and over. The rest of public health, that is not true. We've seen nothing from these other people. Primary care, no. They have somebody who's on the Equity Council who does nothing, who says nothing. It's a farce. I think San Francisco General has taken it seriously. So I have to give them their props, because they have. But the rest of public health, not so.
And the issue of enforcement of Cal-OSHA rules, I understand that Cal-OSHA has accepted CDC rules, which have been downgraded by the Trump administration. They require the right to get masks and not to be forced to reuse masks. Also, they're allowing workers who are contaminated to continue working if they go home and come back, and even if they haven't been tested. Are you concerned that there's basically a downgrading of any real protection from COVID that could threaten the entire healthcare system?
I think there is, but I think that it's up to, that's where the union needs to step. They need to be in, and that's exactly what I meant. They need to be in fighting for their membership. And membership need to be notifying their unions when they have what's happening now. Is a lot of things are happening. Nobody's saying anything until, I may hear about it a month later when it's too late to do anything about it.
So I want to thank both Brenda Barros from SEIU 1021 at San Francisco General Hospital, the chapter chair, and Cheryl Thornton, who is also a member of SEIU 1021 at the Community Healthcare Center, for talking about the fight for their healthcare protection and against retaliation, which is happening, and the COVID pandemic is being used as an excuse to escalate this retaliation. So thanks for joining us on WorkWeek.
Okay, you're welcome.